Hello, my name is Veronica Alcala AG, and today we're going to be talking about the importance of health literacy and specifically patient instruction before they come in to do any imaging exams. I know that many technologists have heard the answers that I'm about to say that patients have given you when you ask them the simple question, have you been fasting? Their answers will be something like, yes, I'm starving, I haven't had anything to eat today, but I absolutely had to have my coffee because I have my coffee every morning. 2 creams, 2 sugars. And you're like, you're here for an abdomen ultrasound. Unfortunately, we're not going to be able to do your exam because I activated your gallbladder, and that's going to render the exam inconclusive. That patient is probably not going to be happy. So, and then we have the other patients who come in and they're like, you ask them, have you been fasting? And they'll say, yes, I'm starting to feel woozy, and because I didn't even take my medication and I haven't had any water. And you're like, okay, well, let's check your blood pressure. Take the blood pressure, and that blood pressure is skyrocketed through the roof. There's no way this patient is gonna have a biopsy today. Again, patient is upset, and understandably so. They weren't told that they were able to take the medication even though they were fasting with a couple sips of water. That would have aided in the confusion and in the delay of their exam. Now we have frustrated referring providers and really mad patients. That also, causes delays in the treatment of the rest of the patients for the rest of the day, and so we have to be apologizing constantly because it disrupts our schedule, our workflow. One way to reduce this is I'm thinking maybe we should have monthly meetings. I know you guys are excited, but it's important. We need to address the health literacy issue amongst our patients. We need to realize that the way we explain things isn't across the board for everybody. People come from different educational backgrounds. People have different cultures and language barriers. And for the language barriers, we actually have the insurance companies that do provide translation services free of cost to their patients. That is something new. Maybe it's not new, but that's new to me. I wasn't aware of that. But patients are able to have translators come with them to their scheduled appointments and be the mediator of communication between the technologist and the patient, and we're able to get better history and provide them with the exam that they need. So it eases that. Also, when scheduling over the phone, they could do a 3-way call and talk to the insurance company representative that's translating for the patient, and we can have the patient be prepped and ready to go before they even step in our office, and that will be tremendous. Another thing I have done is made a simple flyer. So if the patients do schedule with any office, they'll come in and talk to the front desk. The front desk will have these, and it's basically a simple flyer that states what they need to do. So it states no food after midnight, no food in the morning. Do take your medication in the morning with some water, please. And it has a little car here that's symbolizing the arrival time. We do want them there about 35 minutes prior to their exam because they'll have some paperwork to fill out regarding their exam. And then the little doctor symbol, that's actually going to be the actual test time, table time. So all of that's on the flyer. It's easy to read. It's very important. I can't stress enough the importance of health literacy. For patients that are being scheduled over the phone, I've also done some scheduling protocols for the departments. So for MRI, they'll have a sheet that says, okay, this patient's scheduling for an MRI. These are the questions I need to ask. Have they had any heart surgery? Have they had any head surgery? Is there anything implanted in their body that's artificial, mechanical, magnetic? And if they do, if they have a card for it, we need a copy of that, whether it's faxed or emailed, so we can get some information on that to make sure it's MRI compatible and they're good to go. Basically, in conclusion, informed patients that are active in their healthcare tend to feel respected. They tend to feel cared for and understood. these patients tend to come back to our facility for further imaging. They'll be the ones referring family and friends, telling them about how well we've educated them prior to their exams, how they don't have to be rescheduled or tossed around, and that is important to our patients to be cared for. It's important to us as providers to provide that care to our patients as well. Remember that patients have a choice whether they use us or not. So let's have them choose us. Thank you.